Hello, today is Friday, the 15th of April, 2022. My name is Elizabeth Arispe. I'm interviewing David Godines Jr. for the South Texas Archives at Texas A&M University, Kingsville. This is part of the Voces of a Pandemic Oral History Project in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Mr. Godines, that this recorded interview will be placed in the South Texas Archives at Texas A&M University, Kingsville, and shared with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, especially given that your recording may appear online, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 4 questions we need to make sure you agree to before we go on. South Texas Archives at Texas A&M University, Kingsville wishes to archive your interview along with any other photographs and other documentation at the South Texas Archives at Texas A&M University, Kingsville. We will retain copyright of the interview and any other materials you donate to the South Texas Archives at Texas A&M University, Kingsville. Do you give us consent to archive your interview and your materials at the Jernigan Library at Texas A&M University, Kingsville?
Yes.
Do you grant South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville copyright over the interview and any other material you provide?
Yes.
Do you agree to allow South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville to post this interview on the internet where it may be viewed by people around the world?
Yes.
Do you grant South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville consent to share your interview and your materials with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History Project, which will include posting the interview on the internet?
Yes.
We have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. The final storing of the pre-interview form will be at the South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville. We will have stripped out any contact information for yourself or family members, so that will not be a part of your public file. Your public file will only be accessible at the Jernigan Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the South Texas Archives at the Jernigan Library at Texas A&M University, Kingsville?
Yes.
On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes.
Okay, Mr. Godines, can you tell me a little bit about your experience with COVID-19?
With COVID-19, I mean, it impacted, our families, my work. I mean,
Pretty much
what else?
everything.
Pretty much everything. Yeah, pretty much everything.
So how was it that you first learned about COVID-19? Did you maybe hear it on the radio, the television, maybe from your children?
No, we heard it. We on the television. First it started off in China, and then all of a sudden it started coming over here, and the outbreak started happening.
So what was your initial reaction to the information about COVID-19?
Like as far as the breakouts or the outbreaks?
Yes, or maybe just even hearing it for the very first time, hearing about the disease. Maybe what was your reaction at first, and then what was your reaction when you maybe saw that it started to get more serious?
Oh, okay. Oh yeah. Well, at first, I mean, I didn't really worry about it because it wasn't here yet. Then all of a sudden, it's in the United States. People started to panic, and then it got closer. It got to Texas. It got to our community, and that's when we really started panicking, especially when it affected. Since I'm a registered nurse and working with the elderly, once it started affecting them, then I kind of knew, okay, this is kind of serious.
Okay, so it was something that, did you at first think that maybe it wasn't as serious? And then once you saw it affecting your
At,
patients?
yeah, well, when it started affecting, globally, as started seeing the deaths, everybody was dying from it. That's when I started thinking, well, this is pretty serious.
So let's talk a little bit about daily impacts. How has COVID-19 impacted you?
At the very beginning, it impacted me and my family, and our jobs, the community. People were scared to go out. We didn't want to do nothing, want to stay home, stay safe. But then we kind of grew out of that. Once the death toll started going down, people started not wearing really their masks. The mandates didn't have us having to wear them anymore. So it kind of like, I'm not still worried about it, but not too much as I was before, especially now that everybody's been getting vaccinated. And then I believe, a lot of people have gotten disease already to where they create their own immunity. So you don't hear about, people having COVID as much as you did in the past.
And so how do you think COVID-19 impacted your children?
It impacted, well, my oldest not too much. I feel like my youngest, it impacted her just by the school. The school's being shut down and having the virtual learning. You had parents that both work, me and my wife both work. We have our youngest, she was in elementary at the time, still at elementary, but she was elementary. Um, Kind of felt that she fell behind. And, talking to some of the teachers, that was a lot of case for a lot of these students. Not because the school district wouldn't hand out the computers, or it's just, if parents had to work and your child need to be at home, how can a first, second, third grader be on the laptop by themselves at home? No, the parent had to stay, and sometimes that wasn't the case. So you would have parents sending them to the grandparents who are not pretty much tech savvy, and so a lot of the students wouldn't really go online and do their schoolwork. So it's pretty much playing a catch up game, trying to get our kids back to the level they need to be, since the school wasn't open for the kids.
Okay. And so how do you think COVID-19 impacted your family members?
Um, I mean, we've had a few that have contracted COVID-19. Everybody was fine. Now we have family members have diabetes, hypertension. These comorbidities that seem to COVID loves to attack these people that have these more comorbidities. But I mean, the families got their immunizations. They kept their distance from other people that were infected. I mean, we stayed vigilant. So I mean, I don't really think it affected the family that much, but it did affect some family members. Yes.
Okay. And did you have any family who lived outside of the United States that might have been affected by COVID-19?
No. No.
And how about your neighbors? How do you think they were impacted by COVID-19?
Well, I live on a ranch, so I don't know, but my neighbors, just in general, I guess in town, a lot of friends of mine I know, couldn't go to work. Some could. A lot of my friends are nurses, so I mean, we're essential employees, so it really didn't affect them. The only of that not working, but the only thing that affected them was the amount of work they had. Overwork, burnt out, stressed. I have other friends that there was no work, there was nothing they could do. I mean, one person gets sick, everybody gets sent home. I mean, what do you do? How do you support a family like that? So yeah, I mean, that's how I believe how some of my neighbors were affected. Especially in this area.
And how about your church or any organizations you were a part of or you are a part of? How did COVID-19 impact them?
You didn't see that many members in church, for one, because that's one of the organizations I belong to. So, at first there was only allowed, I think the mandate in the city was like 10 people in a place. So in the church was only allowed 10 people at the very beginning. And so we kind of adapted with Facebook Live. So that's how we would have the church services through Facebook Live, to still reach the people. And then slowly but surely, the restrictions, took away the restrictions. You can have people start going to church. So little by little, the church started growing back up again. But there's still some people that decided, that they don't want to be in a large crowd. We made accommodations of, moving seats further apart from each other. One rows for one family. Try to make accommodations as much as we can. For people to come back and pretty much feel like it's normal.
Yes, that's understandable. How is going out into the world during COVID-19 different from pre-COVID?
Oh, scary. I mean, you wouldn't see hardly anybody out. If you did, everybody had, like I said, the face mask. You just wouldn't see that much people out. Everything was closed. So I mean, thank God these stores have curbside. The drive-throughs. That's basically, I mean, it. I mean, it was unreal. It felt strange. It felt very strange, and I'm just glad that we're getting to, a little normalcy.
Very true. I think that is relatable to a lot of people. So, how, if at all, has COVID impacted your ability to gather with family and friends for important events?
Um, I don't think it really impacted that much. The gatherings we would usually have are no greater than 10. When COVID started, and now, I mean, it's still the same. Um, we're pretty much close knit family, so I mean, the only people we see are each other. So I don't think we really had a problem of other people like saying going to um, some other place and bringing back COVID or something like that. We was trying to, just like I said, staying vigilant.
So, did you have any family members that maybe would object to family gatherings, or was everybody pretty much okay with gathering
No,
together?
no, everybody was pretty much. I mean, yeah, pretty much okay with gathering each other. There was nobody that didn't want to join in. I mean, I mean, you love a person, you love a family, you're going to be together no matter what. I know some friends, they didn't care if the family member had COVID, they would still go visit them. They would just stay 6 feet apart or talk to them from the doorstep. They'll be on the porch and they'll be on the ground. I mean, that's how they will still communicate as long as they kept the distance. But I think that really, if it's a family member you're really close to, I don't think COVID would have stopped that person from, interacting with that person, regardless of, other than being hospitalized. But if someone just had mild symptoms at the house but knew they were positive, I mean, that those friends and family would still go visit that person.
Okay. So, who have you interacted with and why?
As far as,
As far as maybe family members,
oh, yeah, I'm sorry, go ahead. Family members and like work related
family
stuff.
members, yes, work,
Yeah.
things like that.
Okay. Well, I mean, family members and work. I mean, so I'm a nurse, so I would still see my patients. I would still interact with my family. But that was when COVID was real strong in the very beginning. That's the only thing I would do: work and home, work and home, work, home, and church. Basically, it. And any signs and symptoms, if I would have had, which I never did, but if I did have them, you just stay away because you don't want to give it to somebody that it's really going to affect them. I've seen people and patients that get COVID mild symptoms. I've seen patients and friends that have it and, they pass. I mean, it just all depends on the person. I feel, how it affects them, how COVID affects that person. So if I knew that person or whatever family member had symptoms, they would tell me, and I'll think, okay, well, I'll keep my distance, talk to you on the phone, we'll FaceTime or something like that. But yeah, that's what we would usually do. That's how we stay in contact with each other. Thank God for FaceTime.
Exactly. I think a lot of people utilize that to keep in
Oh
touch
yeah,
with their family members.
yes.
Has your family changed what you take with you whenever you leave your home? Like, for instance, did you guys maybe start carrying hand sanitizer, Clorox wipes, gloves, anything of that nature?
Hand sanitizer for sure. Me and my wife always had it in our cars, but now we have make sure we have like 2, 3 bottles. Lysol for one, spray the vehicles down. Mask at first. Now the mandates are down. I hardly ever see anybody with masks. So we do carry masks with us just in case, if there's a place that requires it. And of course, we're gonna put it on. We're gonna abide. Or if my girls have symptoms, allergy season comes, they have the little cough. If we want to take all precautions, so we'll have them wear their masks.
Okay, so you mentioned that you did, you do wear masks and you still do, even when it was, mandatory and then now that it's not
Yeah.
mandatory.
Yes.
And
Hmm.
how did you first feel about having to wear the mask? Was there like maybe anxiety about it, or was it,
There.
what was
Yeah,
it?
there was anxiety because I was thinking like this is going to be long term, and everybody was saying this is the new normal. I didn't. I didn't really believe. I didn't want to believe that was going to be the normal. For a while, it felt like it was going to be the new normal. Now, I mean, you don't see that many people wearing masks anymore. A lot of these people are vaccinated, but I know there's still some that are not vaccinated. I haven't really seen any new cases of COVID. I haven't seen anybody testing for COVID recently. So, I mean, I feel pretty good about the direction that we're going, and now that they're studying it more, understanding it more. There's new guidelines. I mean, we're as a country, I believe that they're in the right track. They're doing something right.
Okay. So I know you did speak a little bit about your youngest daughter's education, and I kind of
Mhm.
want to go into that a little bit more. How has COVID-19 changed the way you, your children, or your community receive education?
Well, they'll still do virtual. They do virtual sometimes. They still now they take their computers home. Before they would do no schoolwork on the computer before COVID. Now I guess they saw that they need this. I guess the computers to not the computers, but like to learn how to do their work on the computer just in case anything else happens. So now they come back with work on it. So on the Google Classroom, of course. And now my daughter's, she's pretty good at it. So um, I think that's one thing that that happened with her education that they're following, they're doing. Um, Another thing is, like I said, I feel like she might be still behind. So now they have offering more tutoring hours for the students that are behind. They're pretty much really trying to catch everybody up, catch all these kids up. Um, they'll and before in the beginning they were giving us notifications if a child was positive in your child's class, they would send you a text. They wouldn't shut down the school, but they would send you a text. So, monitor for symptoms. If they come symptomatic, get them tested. If you're positive, let the positive or negative, let the school nurse know. They would have to quarantine for the 14 days. They take the computer back with them. I mean, there was procedures in place in case anything happened like that. So, as far as the education, I think that's all I have to say about that right there. What they're doing.
Okay, so you did mention that, one of your children did face a few challenges moving to an online model of education. Were there any resources or tools that maybe you needed for your child to do well in school, but maybe they weren't accessible to you or your family?
No, we had all the resources. The school was, like I said, if we didn't have a laptop, they would bring us a laptop. Or actually, we go pick it up. If we had any questions on how to get onto the Google Classroom or anything like that, there was always somebody available. Um, but no, there was plenty of resources for us. There was really nothing else we needed help with, just other than you know me and my wife's work schedule. So that was the main thing. Whenever they had to go to virtual, one parent had to stay home while the other one worked, and then when she got back, then I would go to work, and vice versa. I mean, me and my wife work schedule is pretty flexible, so that's how we do it. I would stay in the morning. My wife would work in the morning. She'd come back in the afternoon. I would go work in the afternoon, and then vice versa. My oldest was pretty much on her own. I mean, she was old enough. She knows the computer real well. They were already doing Google Classroom before, so she already knew before pre-COVID. Um, but the thing was, she couldn't really teach the young one because she had her own stuff to do unless she had a break and would kind of help us out. Um, so yeah, but we have plenty of resources from the school. They did help us out a lot, which we're thankful for.
So, do you feel that maybe your youngest child had more problems switching to the online model of education versus your oldest child?
Yes, yeah, especially her being so young. And I mean, the computer's new to her. I mean, the tablets are easy, but when you're doing a computer, having to type, and then I sometimes I felt like the teachers would kind of rush the lesson because they would still have students in school that I guess were um, like children of like the teachers or other students that needed somebody that didn't have nobody at home to take care of them, so they had to go to school. So the teacher had to deal with the students in the classroom and also the students that were at home doing virtual. So I think that was kind of the conflict for the not the conflict, but the struggle for the teacher, having to see both students, one in the classroom, one in the virtual, and then the virtual students really ask. I wouldn't hear them ask that many questions because I mean they're not there with the teacher, and then they're the parent, and you're trying to tell them, well, you have a question, answer, and they just get my daughter would get real shy, so she wouldn't ask. So I would have to actually ask the teacher for her. So I think that's the struggle that she had.
Okay. So, how, if at all, have schools helped your community during COVID-19? Did they maybe distribute food?
Mhm. Yeah, they distribute food. They distribute the computers. So on the food, the bus would come at 12, and they would bring the lunch, and then they would honk, and then they would leave the lunch right there by the door, and we just go get it. That's how they did it when COVID was first year.
Okay, and you also mentioned they did provide tech accommodations. So that included
Mhm.
what? Laptop? Did they include maybe like a Wi-Fi router? I know some schools did that. Did your daughter's school ever do that? Provide Wi-Fi routers for those who,
Yes.
didn't
Yeah.
have any Wi-Fi?
Yeah. They provided the hotspot, and they provided the laptop for the students. If you didn't have a hotspot, they would provide it, and they didn't have the laptop.
And are you in school or are you furthering your nursing career right now at this moment, Mr. Godines?
At this moment, not right now, but I plan to eventually.
Okay, so do you think that you would have faced some challenges if you had been in school at this time?
Um, I think all the only challenge would have been with the virtual, but prior to COVID-19, I was already had been taking online classes, so I don't really think that would have been a problem.
Okay. And did you get your vaccinations?
Yes, I did.
And so what was that like? How did you go about trying to get it, scheduled? Did it take a long time?
No, it didn't take a long time. Our administrator where I work, she kind of encouraged us, to get vaccinated. So, all the staff, we agreed to, we need to get vaccinated. So they just scheduled us there at the local pharmacy there at HEB. We got our vaccinations, the first one, and then they HEB scheduled us for the second one. We got the second one, and that was it.
And a lot of people have said that they had, after effects after receiving the vaccination. Did you have any issues with that?
No, no issues whatsoever. Maybe just arm pain from the injection. That's about it. My wife had sinus problems for like a week, but then that went away after her first initial injection. Second, nothing. She was fine.
So before getting vaccinated, were you ever hesitant about getting the shot?
No, not really. No, I wasn't.
Okay. And in regards to healthcare, what kind of concerns or questions about healthcare have emerged as a result of COVID?
Sorry, repeat it.
I asked, what kind of concerns or questions about healthcare have emerged as a result of COVID?
Oh, well, just some concerns, or I know a lot of people are saying about the shots and do they work? Are they necessary? I mean, how's it going to affect me long term? I mean, we still don't know. So, I mean, I know a lot of friends were saying, well, if you get this injection, you're not going to be able to have kids later on. Well, that's not true because we've had, people receive their immunizations and, they still have kids. And I mean, I we don't know what the long term effects are. I mean, mine's only 2 years old that I got my 2019 received the immunization. So I mean, we'll see.
So, does it change the way that you are receiving healthcare for yourself? Like maybe do you go to the doctor a little bit less now, or do you still see the doctor on a regular basis? I know a
No, I
lot of
still see
people are
the
scared.
I still see the doctor on a regular basis. But I think the way the healthcare is given, that might have changed because of COVID. I know there's some offices, that are having the patients go in virtual, having telemedicine visits instead of going in house. If they haven't had their immunizations. Um, I know a lot of the patients prefer telemeds now. That's one of the big things that I noticed. Now that we had these, COVID-19, they didn't want really sick patients in the doctor's offices, so they would do telemed visits. Well, the patients kind of got used to the telemed visits, so that's all they want now. They don't want to go see the doctor, but now the doctor's saying, no, you got to come in, you got to see us, So, I mean, that's how I think one of the things that changed about the healthcare is now the telemedicine visits are more frequent now.
So I know that you mentioned that you are an RN and you do see a lot of patients. So have you noticed any like maybe mental health impacts on your patients or maybe any challenges that they faced or maybe even challenges that you yourself have faced in regards
Um,
to mental health?
on the mental health, um, yeah, I mean, it's scared a lot of people, and it still scared a lot of people. There's some patients that um, there's some patients that got the vaccines, got the boosters. There's some patients that don't want the vaccines, don't want the boosters. They're just, they're concerned that something's in it. They don't know, how it's going to affect them, and how people talk. They hear stories about, people dying from the immunizations, which I haven't heard anybody die from one. But that's basically the elderly, that I work with, the geriatrics. They fear who also they let in their home and how certain things are done. I mean, it's that's one aspect. Like a lot of anxiety. Yeah.
Yes, a lot of heightened anxiety. How about any maybe depression? Have you seen any
Yes.
patients
Yeah. Yeah.
that
Depression. I mean, there's a
Mhm.
lot of patients that get COVID and it knocks them down. They're not able to do the things they able to do. They were doing before, like a lot of patients. Some are on oxygen. They're on blood thinners now. I mean, they're they'll say, well, I wasn't like this before. I can't do this anymore. I get too short of breath. Or loss of somebody, loss of husbands and wives. These patients together married 50, 60 years. One of them gets COVID, ends up dying. And that spouse is by themselves, and sometimes the family, the kids are not always there for them. So that they're alone. So yeah, I would say yeah, depression for sure.
And how about access to healthcare? Do you think some of your patients struggled to gain access to healthcare? Or do you think everybody was they were able to get the attention that they needed?
I think at the very beginning, the struggle was getting the patients in, especially since the doctors were only allowing certain patients to be in. If you had any respiratory symptoms, you were advised to do a telemedicine visit. Doctors weren't seeing as many as patients as they were before, in a day. So a lot of the visits got, pushed back, their follow-ups, their medication refills. So I think that's how it affected them.
Okay. And how about getting vaccines? Did you see any patients that maybe struggled to maybe find a ride to get a vaccine? Maybe they didn't have proper transportation. Did you see any cases like that?
Yes, there were some, especially in the rural areas, but I know in the local areas there were some nurse some programs where the nurse would actually go out there and administer the injections. Or, they had, the ones at the county fair, at the fairgrounds, when, and at the daycare, I don't think the daycares were open at the time. But yeah, transportation was something a big, because I don't think anybody was transporting any patients at that time either.
Did you ever hear of anybody having any problems registering to maybe get vaccinated with either their first or their second dose?
No, but a lot of a lot of people would get the first and then wouldn't get the second till like a lot later. So I mean that's one thing that I did see. They would get the
Okay.
first one and they know how 21, 28 days to get the second, they wouldn't get it till like maybe 30, 35 days later after the first one.
Okay. So how, if at all, have the organizations you are a part of provided resources regarding COVID-19? I know you mentioned that you were a member of the church. Have they maybe reached out to the community and provided any type of resources regarding COVID-19?
The not really. I mean, really no teachings because they're not medical professionals. So, um, but we would just advise them. When you come in, if you want to wear a mask, wear your mask. I mean, it wasn't mandated. If it was less than 10 or 10 people. So, I mean, now we do have signs on there. If you're sick, wear your mask, or if you want to wear a mask, I mean, you're allowed to, but it's not necessary.
So how about this school board? I know a lot of public schools in the area, they sometimes host vaccination clinics. Did any of the schools in your area host vaccination clinics?
I believe the elementary tried to, they were, but then it canceled. And I
Okay.
know that for a fact because my daughter was supposed to get her vaccinations with that clinic, but then she ended up getting COVID. So
Okay.
yeah, yeah.
So let's talk a little bit about politics. How do you believe politics affected how COVID-19 has been handled?
Well, I really don't try to follow too much politics, but I know it was a big deal in the very beginning, and then now it's kind of out the door. I don't really see them talking about COVID-19 relief funds and stuff like that.
So it didn't really affect the politics that were in your area, or maybe
No,
do you feel like it affected maybe politics in your state or nationally?
in the state for sure. Because we weren't going to be following I guess the mandates that the president had put. We were one of the states that with Greg Abbott, no mask mandates. So
Okay. So let's talk a little bit about work-related challenges. How has COVID-19 impacted your work?
okay, well the work for sure. Now we're required to wear N95s. Any because before COVID-19, I mean I've had multiple jobs. So I would do home health. I would do a nursing rehabilitation center. Prior to COVID-19, COVID-19 hit. Now we had to get tested twice a week in order to work. Before we had to do the PCR testing um, once a week, and I never got to do the PCR testing because my full-time job was the home health I was working for at the time, and my part-time job was the rehabilitation center. So when COVID first hit, they didn't want anybody like nurses. We work multiple jobs. We can work multiple jobs. So they didn't want nobody working in two different facilities. So you had to pick one or the other. So the other facility I was working for part-time, like I said, they do the PCR testing. So I wasn't working there for about 6 months. I didn't work for them until they started doing the rapid testing. So then that was when we would have to go test twice a week. But as far as like the challenges, that's one of the challenges. Just trying to get the facility, make sure you get tested twice a week, get all the staff tested twice a week. And then also when we would get new residents in, we would have to quarantine them for the 10 to 14 days if they were new to the facility, and then we can let them back into the main part of the facility, so they can interact with the patient. So when they were quarantined, I mean, they were there in the room by themselves. So we had iPads that we'd have them talk to the family members through the iPad, because at that time family members weren't allowed to be in the building. Um, but now all that's pretty much gone, but they still have to quarantine for the 10 days when they come in. Um, but the families are allowed. The families are allowed to be with them in the room and visit and stuff like that. So that's one of the challenges I saw. Um, there was really no challenges doing like the home visits, just other than, now we have to be more vigilant, wear your PPE, disinfect. We would already disinfect our instruments, but now you have to, your mask, your bag, everything has to be disinfected. Um, and then questioning the patients prior to the visit, doing the questionnaire. Have you been exposed? Do you have any symptoms? Have you been out of the country in the past 7 days? Has anybody been out of the country, came to visit in the past 7 days? So those are the challenges we kind of face. We do, us being here in South Texas, we do have, families, patients and patients that live in Mexico that, they'll go visit or they'll visit them. So, oh, well, they came and visit me. Well, I'm sorry, we can't see you for maybe like 14 days, until that's when that first started, so because we don't know, when the symptoms are going to come up if, they were exposed to COVID-19. So that's basically what I saw for during our work aspect.
Okay. And how about any loss of work? Did you experience that during
No,
COVID-19?
no, I
Okay,
was
so an
busy.
increase.
Increase. Well, like I said, the part-time job I didn't get to work because I had to
Mhm.
pick one or the other. So, it was my part-time job. So my full-time job, I kept that. Part-time job didn't work for them to start doing the rapid testing. So there was a little loss of income, but that's just extra income. But no, I mean, um, we were essential employees. I mean, we had to work. They even printed out the paper in case we got stopped. Why are you out and about? Well, I'm an essential employee. Look. So yeah, that's how it didn't affect my work there whatsoever.
And do you think it has affected the nature of finding work maybe for other people?
In the medical field or just in general? Oh,
Just in
in
general.
general.
Mhm.
Right now, at the very beginning, yes. Now, I mean, I don't feel like it has. Now, I feel that maybe some people don't want to go back to work. They got laid off and or they're not working right. They weren't working at the time, but now everybody's hiring back and they just got too comfortable. They don't want to go back, but that's just my opinion. Um, but yeah, no, I don't think I think jobs are out there.
Very true. During the COVID-19 pandemic, did you ever have any concerns about your finances? I know you said you were an essential worker, so you always had,
Mhm.
income coming in, but was that ever a worry for you?
Oh yeah, it definitely was a worry because especially my full time job, like I said, it was home health. So we had some patients, some family members, hey, we don't want services no more. They didn't want nobody coming in. So especially the nurses, because the nurses are seeing other patients, and that's their biggest concern. Well, what if that patient's sick and they don't know? The nurse brings it over here to my house, and my mom and dad get infected. So no, I mean, so yeah, we thought that would be a case. Maybe census would go down, but no, we still had work. But yes, I was concerned.
Yes. And so did it impact at least a little bit your ability to financially contribute to your family, or had you guys pretty much been, stable?
No, we've been stable. My wife's a nurse. I'm a nurse, so we're both essential workers. So yeah, but she does work with me. We work for the same company, so we were working for the same company. So yeah, like I said, the census would go down. We weren't getting as many referrals because the patients weren't going to see the doctors. Um, and then no one really at the time, I don't know, was accepting COVID patients, from home, or they weren't, coming home with COVID. They had already been resolved. So yeah, that's one thing we're worried about, is just our census.
So how do you think your work has changed after COVID as opposed to, pre-COVID?
Okay, well, especially with the patients that have high comorbidities, we're more vigilant because we have to make sure that they're okay. Because I mean, we still have patients that are post-COVID patients, and they're very ill. especially after COVID. I mean, and it didn't just affect the elderly. I mean, it affected young people too. People on oxygen still. They just can't recover. They can't walk. Um, I mean, so
And so how have your duties shifted at your work? Do you pretty much kind of do the same thing? Did they maybe put you in charge of other jobs?
no, it's pretty much the same. Yeah, just basically going out to do the assessments and making the care plan for the patient.
Okay. And so how, if at all, have the current social movements in conjunction with COVID-19 impacted your daily life?
Um, I would say none. And the social impact you're talking about, like mandates for masks and stuff like that.
Yes.
Yeah, no, hasn't affected me none. No.
Okay. And what about your perspectives on going out? Do you feel comfortable, or are you and your family still have a little bit of anxiety going out to places?
No, we're pretty comfortable, except we hear a cough. Everybody looks around to see why they're coughing or who it is. So, but no, we're pretty comfortable going out. Now, like I said, now I don't see as many cases as it wasn't in the very beginning, and I don't know if that's because of the vaccines everybody's received, and also, I mean, I know very few people that haven't had COVID already. So I don't know if it's already like the immunity they've gotten from it, because I've had friends that had COVID already twice, and and they did good. But then there's some patients that people that I knew that had family members that had COVID one time and they passed, and I know some people that were young in their 30s, 40s, that had COVID and passed. So, um, but we're pretty comfortable right now going out.
Okay. So, and that kind of maybe shifted a little bit
Yes,
since
yeah,
pre-COVID?
yeah, because pre-COVID. I mean, post-COVID. No, we're not post-COVID, but like now that you know, it seems like it's going away, not going away completely, but it's
It's a
not. You
little
don't see
more
many
relaxed.
cases. Yeah, they're more relaxed. Yeah.
Okay. So, in conclusion, is there anything else that you would like to share with me about your experiences with COVID-19 that maybe I didn't get a chance to ask you?
No, I think you pretty much asked a lot, asked everything.
Okay. So, unless you have any other additional comments, that is going to conclude our interview. And I just want to thank you for your time.
Alrighty, well, thank you.